Hello there, and welcome to the Reflection Show with me, Martha Inspies. For a very long time, I haven't heard about tuberculosis. Most of us will call it TB. When we were younger, we heard TB all around, just like how COVID-19 came and we made so much noise about it. And all of a sudden, nobody hears about TB, but it is still affecting so many people. We saw the late president, Nelson Mandela, being on flyers and posters to create awareness and encourage every one of us to go and get tested. But so many years down the line, nobody is really talking about TB. But TB, it's here, it's with us, it's amongst us. And if we are not keen about it, it will become a pandemic. We don't have to wait till it is a pandemic before we pay attention to it. Today, I'll be having a conversation with Inspired to Act, ITA, who are currently advocating or having a project on TB and making sure that everyone is tested, everyone is educated, everyone is taken through the screening so that you are safe. We don't want to see our viewers out there, our young people out there having TB, because when it gets out of hand, it may be so serious. I'll be having this conversation with the team from ITA. Stay tuned, let's take a break. We'll be right back. Growing up, it was so difficult finding answers to all the questions that bothered my young mind. As soon as I found my purpose and understood my mandate, I made it a mission to answer as many questions as possible, bothering young people. I have mentored, inspired, and helped young people unearth their potentials through the Martha Inspires Foundation. However, I feel it is time to bring the conversation much closer to you. We have you in mind, you the young person. With my team of experts, we bring to you the Reflection Show, a show that focuses on addressing issues young people face, helping them to unearth their potentials, and giving them nothing but the best avenues in helping them solve issues that they may face in their young age. Join me, Martha Inspires, every Thursday and Saturday at 8:30 p.m. on Truth TV, the Reflection Show, restoring hopes. Welcome back from the break. It's still the Reflection Show with me, Martha Inspires. I'll be speaking with Baba Hajara. She's a TB volunteer and also the project manager for this project under Inspired to Act, and Abdallah Abdul Rahman, also a TB volunteer, working together to implement this project. So they're going to help us delve into this conversation much better. Thank you for joining me, lady and gentlemen.
That's fine. Thank you very much to have us.
Okay, so straight to the point. When we talk about tuberculosis, let me start with you, Hajara. What do we mean by tuberculosis?
Okay, basically, tuberculosis is an airborne disease or an infection that mostly or commonly affect the lungs, and it is caused by a bacteria called Mycobacterium tuberculosis.
Okay, what?
Bacterium tuberculosis.
Okay. Just like how we had coronavirus
COVID-19.
So we have
Bacterium tuberculosis.
Okay, I'm just saying this just for the students. You may go to class and this question will come in science for you. Okay, so yeah, delve into more.
Okay, and it is affecting the lungs. It is commonly affecting the lungs, but it can spread to other parts of the body.
Okay.
Yes. And also, this tuberculosis can be spread through coughing, sneezing, singing, shouting, or any action that can make someone produce droplets out of a hand. And if a healthy person inhales the droplets, it can make the person to contact the disease. So it's just an airborne disease.
Hey, so it means our nose mask. We don't even have to stop wearing this our nose mask. Mr. Abdallah, what are some of the signs?
Okay, before we go into the science very still, we thank you very much for the opportunity.
Thank you.
Yes, this is a very core platform that we think that an awareness raising, which is part of her core mandate, which we are currently implementing, will be a pivot to taking it far. Adding to that, of course, she has indicated it's a bacterial infection. Of course, these bacterial infections comes in two forms, where you have the latent part of it, and then you have the active part of it. Now, they say that there's an acronym that goes that TB anywhere is TB everywhere.
TB anywhere is TB everywhere.
Because one person who is sick of TB can infect the entire Cataraga, the entire Tamale, because of what she said.
The
Coughing,
droplets.
once the person coughs and brings out the sputum, it can hang in the air, especially in our very comfortable areas where there's an AC, the environment of the room is a bit conducive. Then they can suspend in the air for not less than 10 days, some say up to 30 days. The bacteria can remain in the air, suspended. When you enter, you breathe. When another person enters, they breathe. It will remain in your system. Now, at the latent stage, you won't have any effect. But of course, within the latent stage, you don't have the infection taking over your body, giving you the symptoms like you have asked me, which I'll come to very closely. So now, within the latent stage, if the person is not, let me say, raised, if the person is not aware of the situation within the body, you tend to think that you are safe. Unfortunately,
You are not.
Unfortunately, if not tested, that is why we are always we're telling everybody who is going to listen to us, get out there, get tested, and make sure that if you are positive, of course, as we are going, we'll get to the point where everybody would know that you are at risk. So now at this stage, we would say that at the active stage, that's where symptoms begin to come in. You have consistent headache every day, chest pain, fever, night sweat. Every day somebody is there, you might one day hear this. Every day the person goes to sleep and wakes up with sweat all over the body. And you don't know how it came about. Then the person also tells you that
just feeling
all the time, consistent back pain or body pains was one of the symptoms. A lot of people continue to go to the pastors and go to their malams looking for cure. They will get the cure only at a point all of us would not like. Unfortunately, a sputum test could just save you. So the listed are some of the symptoms and signs to tell you that all is not well. So let me take it again. Consistent headache.
Consistent headache.
Yes.
Hey, it's one day I'm thinking about myself.
Two, you have chest pain and then you cough consistently. All the time you have that cough.
I'm scared. I just coughed.
So now,
consistent headache, chest pain,
yes,
coughing, and what?
Night sweat, fever. Yes.
And also loss of appetite.
Loss of appetite and weight loss.
Weight loss.
It's just another great sign of TB. Let me also be quick to add that we have TB comes in two versions. Now these are the types, the stages that they find themselves. Now we have the pulmonary.
Okay. I think she wanted to add something on the signs.
Yes,
okay,
I wanted just to add the weight loss and fever.
Okay, so let's look at the stages.
Okay, so what I can say is that we have the pulmonary tuberculosis, and then we have the extrapulmonary.
Again?
Pulmonary. Yes.
Okay.
That particular stage or type of TB comes within the first 3 weeks. And you see all the signs we mentioned, some patients are likely to have it. I don't know whether we'll get to the place where you need numbers for us to talk about the region. Now, when this situation comes and the person finds him or herself in this particular level, the person is affected only by the chest, coughing, headache, and all of that. But at the extrapulmonary, this is the stage it has left and started attacking other parts of the body. We have the brain. TB affects the brain. Somebody can be there, no cough, but there's TB affecting the brain of the person. The bones, it can attack your kidneys, can attack your liver. So TB can attack every part of your body. So you see why everybody must be tested.
Wow.
Of course. So these are some of the areas we can highlight a bit for people to understand that you might be having a TB of the bone. Let me share an experience. At Myong, there was a man under our program who all the time was coughing, and he always went for this herbal concoctions.
Yeah.
Never went to the hospital. Weight loss, all of these things didn't even ignite the person. Till they were not afraid. People started moving away. I'm sure we'll talk about the rights. Now, this man started having back pain to the extent that he could no more move. Fortunately, his son took him to TTH. They went through the test and all of that. The person wasn't coughing, the lungs are already weak. So they went for an x-ray and they realized there was a TB in the bone. As I tell you today, if you see the man and they'll tell you that he has ever been affected by TB, you won't believe. He's back to his feet, 100% cured, and the person is doing very well. So now, because of the TB of the bone, it fortunately didn't affect up to the other organs that is going to cause death.
So the brain, the bone?
It didn't attack. It was just the bones that the TB affected. And so I would say that for us to be able to remain safe, the surest banker is what? Testing.
And I think that the advocacy on TB has gone down very low.
Yes.
I think that even until I spoke with Mr. Rashid, ITA boss, who mentioned that there's a new project on TB. At the point I was like, hey, TB, like, you know, it's been a very, very long time. And I was just wondering, you know, why TB, until I realized that you guys had been through communities, debtors, you know, bus stops to test, and you have had some few cases coming up.
Yes, so many cases.
Let's look at misconceptions on TB.
Okay. Some of the misconceptions around these TBs, the most commonly misconception is when you get to the communities and you ask them what they know about TB or what causes, what they can tell you is that when you are having sex with your husband or wife and you cough onto the other, that you get the TB disease. And that's never true. That's never true. So at a point, if we ask them like that and they give us their knowledge or idea, we also give them what it is and tell them that what they know is not it's not what is actually the case. Okay. And some of the misconception too is they think that this TB disease is a death case.
Okay.
Like if you contact the disease or that you just die. And the problem is because of the much stigma attached to it, most of them don't want to own up to
for treatment.
For treatment or to make people know that they are having the disease. And because of that, it's spreading quickly.
But I think that with what you are saying, it means that the diseases and the things happening, we need to constantly check because I'm told COVID-19 is still really there. People are testing. So COVID, and because COVID is no more there, we have become so careless in coughing. Somebody is worse. People spit on the floor. People cough without covering their toe. Let me come to you again on misconceptions. But I want you to add, how can we also prevent, you know, these things? So misconceptions and prevention.
Okay. So misconception and prevention is core for our very lives. Global Fund, one of our, we have a project, unlike she stated earlier about we have TB International project funded by a chain of donors. And so we at Inspired Track, we are very grateful for our donors for that opportunity for us to create the awareness at the local level. This is a practical experienced person on the grounds. They have been to the people, they've spoken with the people. They know the people are telling them, this is what we think. You agree with me? She just told you something. Another key misconception is, if I come to you, the health practitioner, you will tell my wife that I have TB. That's another big
they don't trust the health practitioner.
Is it trust? Is it trust? I would say that
fear
that another person will know that I have it. So because of that, and they like she said, they think that it's a death sentence for you to have TB. We are sending the record straight. Anybody with TB at any level is curable, not treatable. Is curable. You are going to get cured completely. Of course, we have something that is as a result of drug resistance. We are talking about prevention. Prevention of that's one thing I would like to add. Another misconception is that only TB affects only people of the lungs. So you see them coughing. No, you can have TB for more than 20 years. You will never cough, and TB will be within your system, damaging it. Get out there. Get referral. Don't always assume that all is normal until you go and they tell you that all is normal. The TB test is a simple strategy. Come, we screen you, we give you a container, you cough, the phlegm that comes from your chest is what we use.
Take your time and explain that. That is the test
Yes.
or the screening.
The test.
So
The
if I want
screening.
okay, so is there a difference between the test and the screening?
Yes.
So take our
I would like Ajara to.
Okay.
The screening is the process where we allow you to cough out the sputum for us to take to the lab. And the testing is what the lab technicians will use the sputum to test to see whether you have the disease or not. So the difference is just the process of bringing out the sputum is the screening, and the testing is what the lab technicians the process they follow to know whether someone is positive or negative.
That is right. The process, and let me break it even much more down. For instance, I ask you are coming for me to screen you, right? The first question I ask you is that, okay, what's your name? You're this, you're that. Has any family member of yours ever been affected by TB? You say no. Then I go ahead. Do you have headache? Are you coughing? Do you have temperature, fever, sweating at night? Do you have body pain, bone pain? So these questions I'm asking, I'm screening you. At the end of the day, I get 3, 4. Now, the TB World Health Organization is saying that when we have 2 only symptoms, only 2, let's go ahead and test you. So we take your sample, we take it. Look, the test is even free. Can you imagine? Why are we not testing? The test is for free. So when we come, we test, we take the samples to the lab. The lab technicians will give us your results. And one thing I'm going to tell people is that be guaranteed, the secrecy is with us. If I screen you, Ajara would not even know. At IT, Ajara would not know. Ajara may only know because she's a coordinator of the project. We are reporting numbers.
But
and
she
I tell
may
her,
not even know everybody if you even
Exactly.
organize a screening
Yes.
activity. She may
yes,
probably
she would
see you
even
come.
know.
She may
I
not
will
even
be the
know.
only one who will come to you, possibly take you to the hospital, link up with a doctor, will produce you. The medicine is absolutely free.
The treatments,
Oh, the
Yes.
treatment and the medications
Yes,
are
all free. From testing
Hey.
to treatment,
treatment.
everything about TB is free. That's the reason why the whole World Health Organization, you know, recently we have a pandemic, I'll call it a pandemic at the NGO sector, where the USAID projects stalled. At the Commonwealth, at the Common Assembly in the US, presentation was done on TB, and immediately in less than 2 hours, funds located to TB
Were
was released.
restored.
Why? Because one person having TB in Ghana can
It's a
affect
lot,
more than
very
states in the United States. So everybody is not free unless all of us test and get treated. So I would say that part of the treatment process is we must also ensure that we cover ourselves. This is the physical part, personal hygiene, very important. And when you start coughing, don't assume that that is fia fia. In my part of the world, they say fia fia. Don't say it's just fia fia. Then you just go and buy a drug and then you take, and then the catarrh moves away. If it is catarrh, fine. Maybe something somewhere has gone to lie down and start causing harm. You don't know. So we say that try to be, when you are seeing 2 of these signs, we just listed a number of signs and symptoms of TB. If you have more than 1, kindly look up to the hospitals. There are TB focal persons are there from every hospital now.
Even including our Tamale Teaching
Chips
Hospital,
compounds,
the
Chips
Central
compounds.
Hospital, SDA Hospital,
Exactly.
West Hospital.
Yes. When you just enter there, you know, we have the public health units. When you go to the public health unit, you have our TB focal persons there. Of course, when we are leaving, we'll share our number. Anybody within our jurisdiction and area of operation, and you call us, we can be able to come for your sample, and it will test same, and then your results will be given to you. So these are some of the prevention method we can use. So covering of your nose mask, right?
Yeah.
Personal hygiene, make sure you are clean.
I think that even if we brush and take care of our teeth or our mouths or whatever, well, it can also play a way to reduce
You
or
know,
it can't?
no, that one may not, and it would. You know, general health is very important. Immunity is the core of TB.
Okay.
Your immunity is what will hold on it. If your immunity is weak, the TB will crack you and you become a vessel. Remember I told you the TB is in 2 stages, latent and what? Active. So at the active stage, when the person coughs in this our office or where we are seated, unfortunately, would have to sanitize the place, otherwise nobody will be safe.
Wow. Let's look at rights
Uh-huh.
violations.
Rights,
Rights
yes.
violations.
Oh, I should go.
Okay, if we come to the rights violation of TB patients, let's take the community stage for instance. Like family members or friends, when they find out that someone is having the TB disease, they will tend to isolate themselves from the person. That's the stigma. They will not want to use even spoon, cup, or bowl with the
Person.
infected person. And this can't let you get, you can even, an infected person can use a spoon and eat, and you too, you can use the spoon and eat, and you will be infected.
Okay, I thought
It's-
because it comes from, droplets.
It's
and
just
what.
The sputum.
inside-
The
okay,
sputum.
drop-
The sputum.
So because of that, this violate the rights of these TB patients. And even at the health centers, some of the nurses, they don't want to be assigned to these TB patients for
Okay.
treatment. Just for the fear that they may also get
Contract
the disease.
Wow. It's kind of interesting because I think that right now we are getting to know that I don't know how to put it, whether to say the emergence of TB again. You know, the advocacy had slowed down.
Yes.
Yes.
For me, I don't know of anyone watching or anyone,
Yes.
if not this year that I got in touch with IT, I wouldn't have known that TB is even still there.
Yeah.
Because of the stigma, that's why people don't, because the disease is there, but because of the stigma, people don't want to own up or to show up for the at the treatment centers for treatment. They don't want people to know their status in order for them to be stigmatized or be isolated.
What are we doing to reduce stigma?
Okay, this is where we are. This stigma is because of people not having much knowledge about. So that's why we are on the in the community sensitizing and educating people about the disease. And we also train some health workers and some faith-based actors because they normally meet with people, so they can also share their knowledge
Education.
with them to also share to people they are living with, so that we can reduce the level of stigma.
Okay.
That is great.
What's more
Let me add up a bit on that. You see that the podium of our pastors and imams are very powerful. You agree? And so IT, part of the ways and strategies we've adopted in this project of ours is that these imams were trained. They were made to themselves appreciate the situation have just made you to understand that TB anywhere is TB everywhere. And you are not safe as an imam. Tell the person who is sick and coughing and having the symptoms we are talking about.
Maybe they don't also know. So why don't we have a strategy where we reach out to avenues where people go for second help apart from the hospital?
Yes, and that is what IT is doing. IT recently, I think she led the team to the prisons. The inmates were tested. Recently, we had a market storm at Abu Abu. So many of you saw it, yes. So we, apart from that, we have we had another different sensitization at another central mosque in Jakarta, where we organized the people and the women came and men, malams. They came in their numbers and then so we go community to community, market dates, and then we are able to sensitize, take sputum and test. At least we try to let them understand the importance of not stigmatizing your colleague. Because once the person keep quiet, all of you in the house are no more safe. You understand? So another thing I want to add is that can you imagine a study done by Adongo et al. Suggests that the northern region prevalence of TB cases out of 219 participants, 74% of them were men.
Wow.
Now, out of this 74%, 26 were female. Now let's look at these marginalized women, 24. Most of them are those areas where the detection are done more. Do you know why? It is because the research says that they come to the hospital more, and so they are able to bring out their concerns to their doctors, and they are able to get treated. Now let's come to the men. All the 74% that was captured, none of them will show up at the hospital. They end up in their graves, thinking that it is just this. He will decide what sickness it is for himself. And so this prevalence, this age disaggregation of 40% plus in terms of men and women forms about 96% of dominant cases of TB.
Wow.
I don't know if you understand what I've said. 40% of age, more than people age 40 and above, tends to have more prevalence of the TB case.
Than those who are 39,
now I want to add that if you look at people living with hypertension, diabetes, HIV, they are more prone to TB diseases because their immunity is already compromised.
Yeah.
And so what I'm going to say is that people with conditions, let's not sit down and assume for ourselves that this is what is happening to me. It's not everything that is happening to you that is the diabetes that is causing it, or that is the hypertension that is causing it.
Your system may be weak. That can also attract other conditions.
For instance, more likely, all of us seated here might have encountered the Mycobacterium tuberculosis. It's a bacteria. It is in your system. You are strong. Your immunity is strong.
It's possible. I have to scream because it's like the things you are mentioning. I feel like when I'm stressed, I feel some pain in my chest.
And
I have headache.
There was something I wanted to add, and that is diet. Diet is a very significant preventive tool we can use.
Well.
Eating well. And when they say eating well, what does it mean? I
Having
think
a
the right
balanced diet.
A balanced diet. Yes. And again, taking more of your, taking less. You know, at the part of the world, we're always on carbohydrates. Plenty of rice, plenty of TZ, plenty of kinky, plenty of banku. At the end of the day,
TZ, banku, kinky, akpele.
All of them is carbo. So at the end of the day, you put your system under a very serious pressure. So people watching, today eating banku too is a problem. We're not saying this is a problem, but you need to ensure that, like she indicated, a balanced diet. So at least your system had that leverage. And some that relieve your system. That is, once in a while, you can go on pure vegetable soup, and that will be your food. Your system
So
get
eat
opportunity
bra.
to.
If you are from Bolga, like
Or tamale.
or tamale, eat bra.
More.
Ayoyo and all that.
Yes.
But look for a Fafra woman to prepare very nice bra soup for you. Our bra soup is special than any. You see the whole 5 northern regions. We are those who prepare bra soup the best. Not even the Gombes.
Wow.
Not even that.
This
that
one
is come
we
here.
will give you the win because the reason why we will give.
It's true. We prepare the best bra soup.
Well, the reason why we will give you
the
reason why we will give you the win is that we want everybody to instill that one night go for a whole night, not with TZ or small TZ, put plenty bra soup, and then you take,
and you
give your
some
system.
shea butter on the bra.
Exactly.
Oh my goodness.
Exactly.
I feel like eating bra today. Let's take a break. We'll be right back. Stay tuned. Growing up, it was so difficult finding answers to all the questions that bothered my young mind. As soon as I found my purpose and understood my mandate, I made it a mission to answer as many questions as possible, bothering young people. I have mentored, inspired, and helped young people unearth their potentials through the Martha Inspires Foundation. However, I feel it is time to bring the conversation much closer to you. We have you in mind, you the young person. With my team of experts, we bring to you the Reflection Show, a show that focuses on addressing issues young people face, helping them to unearth their potentials, and giving them nothing but the best avenues in helping them solve issues that they may face in their young age. Join me, Martha Inspires, every Thursday and Saturday at 8:30 p.m. on Truth TV, the reflection show restoring hopes. Welcome back from the break. We are still here talking and looking at tuberculosis. It has been one of the health issues that has been abandoned for a very long time. But today we are back to that conversation because Inspired to Act, an NGO here in Tamale, is implementing a wonderful project helping us to unravel the mysteries behind tuberculosis. Still in our communities, still with us and among us. Let's look at what ITA is doing.
The TB project we are implementing is in twofold. One is screening, educating, and awareness raising, and the other is TB case finding.
Okay.
The awareness and education and awareness raising, we do go to communities and educate them about the TB disease, the symptoms, signs, and mode of transmission. And for the TB case finding, we do a little education and we take we screen them and take their samples to the hospital for testing.
Okay, so to add up to that is at ITA, like I told you, we have Stop TB International, and then one of our donors, in this case, the lead donor is Dawa Academy, which we are looking at the awareness raising like she indicated. Of course, within the presentation, we mentioned that we have trained health officials, nurses. Why are we training them? They are supposed to understand the rights of the patients with TB. They are marginalized, stigmatized, discriminated against by the same health officials who are supposed to be professionally. Well, when they get to understand the rights those people are, or that those people that they are dealing with are being violated, at least it will be kept. Yeah. Now we bring them district by district. We are dealing with 6 districts. 6 districts that we are dealing with this particular awareness. Yeah. So now in this particular awareness, our intention is very simple. These districts are Bimbila, we have Yendi, we have Gushagu, we have Karaga, we have Tamale. Have I excluded some? So these are the districts that we are dealing with. Now in this district, we have gone to train almost, if not all, health officials to understand the need for them not to stigmatize those people. Sometimes professionalism decay if you don't renew, right? So we say that we come to you, we let you understand the havoc of TB. TB is killing people because of ignorance. Some people are not coming because when they come, once they say, hey, Mata, TB patient now bow, then you cover their nose. Yeah. Another person is covering their nose. The TB patient is lying down. Who is going to administer them? The person even feel like going home and dying is better than lying in the hospital. We come to let them understand and remind them, you are professionals, but these people have rights that you must respect. Now, apart from these people, we also brought the imams. Within the same Stop TB International project, we have brought imams in all the 6 districts I've spoken about. We brought them district by district. We have trained the imams, we have trained pastors. Why are we training them? These people talk to thousands of people on Friday if it is the imam. On Sunday, the pastor will talk to hundreds and thousands of people within the villages. When they go back, they talk to the people. Oh, we used to think that anybody they say was having TB, nobody goes to their house again. It is true. Anybody they say this house, or TB,
target TB house.
Then everybody is running away. Then we now let them understand that TB, this saliva cannot give you TB unless the cough.
Yeah.
So until the cough comes, so this education went down well. They went in groups. We were able to understand it very well, and understanding that a little marginalization towards the TB patients is an effect to the entire country. So now, after the faith-based actors, we have also looked at going into the community. We are moving district by district, community by community, sensitizing the populace, letting them understand the significant effects of TB, how to curb TB, the signs and symptoms of TB. And when we do this, they come in their numbers, then we are able to educate them under the Stop TB International project. Now, after this awareness, God being so good, another GC7, we call it the GC7, another project funded by Global Fund and the Anglophone. We thanks to all our donors for this particular opportunity. This is a direct project. So now, Stop TB International Ghana or Stop TB Ghana is those we are partnering with in doing this. They are donors. Now this one, what's the essence of this? The test centers have been established by World TB or TB at the international level. Tests are done at so many areas. We have I think you can help me with that, the areas we are testing. I think Central Hospital is there, right?
Yes.
And then we have TTH, and then that
Advanced
Global. And then I think there's one at Habana, or Habana also comes.
So these are the centers that people can
come to test. Okay. So now our project essence is that we come under the screening we do, like she indicated, you now know what screening is. So in the screening we educate the people, we take your sputum. Then the sputum will collate them to the labs. This is a project funded by the Stop TB Ghana and then the GC7. Now the essence of that one is to actually test you.
Okay.
Now somebody comes to us, oh, me I have 3 of your symptoms, but I don't cough. We refer you to the hospital. They go there, they do the x-ray, and hey, the liver is already affected. The kidneys are affected. Fortunately for the person, it is not the normal kidney disease that you know, because it is TB. When you get the right treatment in the hospital, you will be cured like nothing had ever happened to your body. So that is what ITA is doing in the communities currently. So apart from the awareness we are raising, this project has come to augment our awareness raising we were doing earlier. So now you see that when we go to Bushago, we go to a village, which is on their market day, with our megaphones. We educate them. They come in their numbers. Yet we pick their sputum. And in taking our sputum, we even take out to their house numbers, their
Is it
relatives.
painful?
No. Nothing is. It's not painful. Coughing is simple to cough. Breathe in, full, and you try to cough. In the 3rd round, you will find phlegm coming out of your lungs. That is death. The disease, the bacteria are found there, and we can be able to trace and treat. So this is what ITA does, basically, to support our support to the community and for our constituents. Yes.
So it means that it's youth friendly.
Yes.
Anyone can come.
Anybody.
Anyone can contact you.
Yes.
But have you gone to some communities and you have, been resisted to screen or to test people?
No.
Great. Which means that people are accepting.
Yes.
You know, community entry, they say, is the way forward. Why is it the way forward? Because if I am entering matter in spice and I enter well, I'm likely to given a proper reception. The agreement you will agree with me here is that if the chief of a community is seated and you walk in and tell him the signs and symptoms and what awaits us,
and how
where we are,
the screening can also help reduce all of those things in his
I think this one will lead us to the next leg of the conversation, where the prevalence of TB within his community he's not aware of. The chief, I mean,
is not aware of.
he's not aware of, and would never be aware unless that situation gets dire, and which we are praying against. And so we say that the communities to these where we go, all of them tend to give us more attention. Even in organization, let me add that sometimes you are invited by an organization to come and screen the entire people there, so that they are able to, just like Matter and Spice entirely. So we come and screen you, we take the samples, we go and test, and then we give you the results.
Wow.
Yes.
Wow.
So this is what we do at ITA.
I like the fact that it's free. And
we don't pay.
We said we like free things, except health screenings. Ghanaians are very funny. We like free things, free food, free clothes, free everything.
May I tell you why we are afraid of free screenings?
We are
Fear.
afraid of the reality.
If you inform me I have TB,
Okay.
sometimes our health professionals, excuse me to say, they sometimes present the information in a hard way.
Okay.
So We at ITA are trained. We don't even come to tell you that you have TB. When we know you have TB, I am there because you rightly introduced me, volunteer. I come to you, I tell you, we did test, right? We want to go to the hospital with you. There are professionally trained psychological people there. We take you there, they will inform you to let you know that this is the situation, but it is curable and you are fine. And that at least everything is going to be okay. So fear is the reason why many people do not want to be what? To be screened.
Yeah.
I will add that let's be afraid of what is not curable, not what is curable. TB is curable. Thank you.
TB is curable.
Yeah.
TB is curable. So wherever you are, just make sure that you get, But outside Tamale, do you know, is it like a common knowledge or a common information that people have?
Yes.
That they can walk into any facility to get screened?
Yes, because when we do go to the to communities and centers, and we do give them this information, that if you find any of these symptoms around your body, you can visit the health facility for testing.
Yes. So communities, we have CHIPS compound, we have what? Health facilities, right? CHIPS compound, and then you have polyclinics, and then you have the district hospitals, and then you have special hospitals. All of these places, if you walk into any of them, provided they are government, which is much more expanded, walk into any of them, there is a public health officer there. The person can take your sputum, and they have all the facilities to take your sputum, and they can go and test. No matter the cottage you find yourself, just locate that health facility you usually go for.
But I believe that in Ghana, well, maybe a lot of facilities, but I believe there may be some few facilities that may not, especially in the rural areas, that may not have the logistics to test or to screen.
Test is one, but screening is almost all the facilities, right?
Can screen, but test,
they will take it to the nearby testing place. Like Yendi, you have the Yendi hospital, yes, where they do the testing. You have the Garaka hospital, they have the test things there. So almost all the district hospitals, I think they have them, right?
Yes.
The test systems are there, are provided.
Let's delve more into the numbers.
Okay.
In northern region.
Okay, so I think that part, let me take it because we are numbers people. So if you look at the numbers, it's a bit scary. By estimation of research of this same Adongo I said, and
so before, just to add that, when did you start? And as at now, the numbers you have seen.
Entirely. If you look at TB has not been on the low side. In the 2005, there's a research paper I have read on around 2005 coming to 2016. And you see that the prevalence of TB, the research scope was a bit slower. So we cannot use that as a justification that the lower numbers then is as a result of maybe, let's say, higher numbers now, because the research scope was lower. In this current research work, I want to talk up to, and that is where I think that all of us must begin to reason, must begin to think into how are we going to ensure, even if Martha hears that in this area one patient is suffering from TB, she should be that advocate who is going to let the house people know that, oh, because that person is having TB, it's not a death sentence, the person should not be marginalized, the person should not be discriminated because of me, who is not even in your house.
Yeah.
I said something, I said in a humidized environment like this, where you have the AC, you have whatever, the situation is fine. When the person coughs, it remains. What about if it's in the sun rays? Let's leave our environments open. Another intervention I just forgot, I want to bring it in, is that sometimes when nobody's in the room, off the AC, open up, let the sun rays enter. The sun rays kill the bacteria. So if someone coughs...
then this heat season in Tamale now, bacteria will die.
And even, you see, you didn't ask a question which I was expecting. Look at our markets. Look at our market. Ababu.
Yeah.
Somebody goes with TB, coughs. Wow, the person doesn't even cough and covers the mouth. The person calls. You ask me that place, then everybody is affected by TB. No, it is because of the sun rays. They will, in less than 5 to 10 minutes, every one of it is already down, and they are dead. And so we are talking about the numbers. We have research that says that 2 million plus populates. I told you we have latent and we have active cases of TB.
Yeah.
Out of the 2,300,000 and something people, that was done within northern region alone. 7 districts were earmarked. Now, Tamale tends to dominate, and I will agree with them because Tamale has the dense, is one of the most populated metro within the northern region, the assembly within the northern region. Now, these 2 million plus people, when information was given out, a lot of the people, after tests upon tests of about 6,000 people, out of the 2 million people were tested, but upon information that was given, about 64% of them tend to think that they would not even prevail themselves to be tested, let alone to know whether they have TB or not.
It's like
and that is scary.
When COVID came, people
Exactly. When I go and they say I have it, then it becomes challenging. But what I do, I don't go. I remain in my room if I'm dying and I die. Forgetting that anytime you are dying, excuse me, this is an appeal. Anytime one person is dying of the TB, you have children who will give birth to children and they will continue your progeny. The unfortunate thing is that anytime you cough, your sister is not safe, your mother is not safe, your brother is not safe, your auntie is not safe, the entire house is not safe, the community is not safe, just because of one person who decides that I will not go. It's an appeal. Let people live. Even our religious scriptures tell us to preserve life. It's part of preservation of life for you to come out and test. We at Matter Inspire, I think with time we'll have an opportunity for people to come and test.
Sure.
Let us always take advantages of these opportunities and come out. So the numbers are a bit scary. 64% of the entire 2 million population are telling you they will not come and get tested.
That is more than half.
More than half of the population thinks that I won't come. Keep your sickness. I won't even come for you to tell me that I'm sick. And again, I would say that apart from this, I have already indicated that the numbers within the northern region says that 74% of the people who are affected by TB and they die are men.
Wow.
74% of them who tends to die are men. And a lot of them are above the ages of 40. At the age of 40, you agree with me that by 40 years, somebody who is always on carbohydrate.
Life begins at 40.
Yeah, you know. I've read somewhere they say that you when you look at the numbers, it is that way because many of us tend to be on carbohydrate with our children from the day go. They eat TZ in the morning, they eat TZ in the afternoon, they eat TZ at 40. By all means, the person system will be compromised.
We are told it gives strength. So they can
farm, it's energy.
They can work. Yes.
But you agree with me that the age of the time we were farming, somebody could go to their farm and farm in such a way that you see the sweat in the person, you know that the person has worked. Tell me, you and I, we eat more. Take a lot of banku, take a lot of rice.
You just talk about walking. How many of us wake up in
get
the
up
morning
and walk, exercise, which is part of the preventive mechanisms. So the problem is that because of the 40 and above, many people tend to have early part of diabetes. They call it, excuse me, the name is gone. At the early stages of diabetes, pre-diabetes, they are exposed. That time you can't call it diabetes. You just need to regulate your diet and your system will come back to normal. How many of us will even go and check the diabetes crowd? So after 40 years, we are telling our members that don't even sit down to get to 40. Eat well. Do a lot of exercise, check yourself. And by the grace of God, as for death, all of us will die. Whether we like it or not, but live a good life.
No, when I'm 100 years old.
Yes. You have chosen 100, I would even say 200. You see.
Too far.
So you see, I would say that the numbers are scary because men have chosen to tell ourselves that, look, we are strong. And we'll cater issues by ourselves. And so the data is telling us that 74% of us who have come out of the 6,000, greater portion that died were men. And these people are people who were even having clear signs and they were bringing themselves only for curability. And you know, when it gets to the end stage, when TB gets to the end stage, probably the kidney is already destroyed, the liver is destroyed, the bones are already... Oh, how can you be there? You can hold your own bone and crack it and it will be broken.
Wow.
Wow, that tells you that the sickness has already taken over your body. So as we are still strong, we can walk, we can talk, we can do our work. Let us get tested and everything will be fine. So what about the female? These 26% remaining, they tell us that are more likely to be treated. Why? Because they are able to detect early. Once you are detected early, prevention can come in, or what treatment may set in. So at the numbers point, we say that the northern region prevalence of TB is better. Why? It's better because of the temperature we have found ourselves. A lot of the time it's the contact tissues that are having the problem. Contact tracing. Somebody is having a TB in Bimbila. They tend to get the person because the person came to TTH to seek medical attention. How have the officers traced up there to pick the household people samples to go and test? How many people came in contact with the person? Test them. These are people who are most likely to, if they are prone to diseases like diabetes, hypertension, and all of those issues, and HIV, they are likely to have, when they contact TB, TB tend to spread quickly into their system. Unlike you and I, probably we don't have any of this condition. So when you even have it, your system will fight it and it will go and be lying down and resting, waiting for you the day that you become weak. Then it will strike.
Wow.
You see, so practically these are the numbers within the northern region, and so we tell our people in Tamale that TB is at your back door everywhere, unless you make sure that your community is free of TB.
Your community should be free of TB because I think that it will help us reduce a lot of health issues in our communities. And how do we? Finally, we don't have a lot of time. How do we encourage each other to go and test?
Yeah, what I would say is, like, especially the problem is just the stigma. Even someone will be having the TB disease, and you the one stigmatizing the person. The stigma can even kill the person without the disease killing
itself. Wow.
So
Very
in order
important.
for us to encourage ourselves to go and test, we should encourage each other to avoid stigma. If we avoid stigma and someone finds like some of these symptoms in their body, they will easily go to the health facility to test to see whether they have the disease or not.
Okay, okay. And let's look at ITA. Tell us a bit about ITA, the things that you do, and where can you be located and contacted.
Okay, should I go? Okay, so at ITA, generally, Inspired to Act is the ITA, right? So ITA, we have a lot, and we are into a lot of areas that we work, but I'll give you a brief answer, and then I'll respond to another issue about TB. ITA, we have our thematic areas. We are into universal access to health. So you see that we are looking in TB is universal access to health, maternal and childbirth issues, and all matters relating to health. ITA, we are interested in it. We have governance and accountability aspects. So we also have a project under our thematic area, governance and accountability, called HEAD. If you follow us on Facebook, if you are following us, you can follow us on Facebook, Inspired to Act, right? So Inspired to Act, you see our pink-like logo on with three.
Orange or pink?
Okay, orange, right?
Orange,
right? Thank you for the
man,
guidance.
I won't blame you. Men are colorblind.
Okay.
Yeah.
So
orange
yes,
color.
orange light color. Yes. So you with three stretch hands. Yes. So when you check us on Facebook, you'll find us. So we have governance and accountability, and probably maybe
and also women and girls empowerment.
Women
yes,
and girls empowerment.
yes. So these are some of the areas where, and many more, many more areas. So we at ITA have a HEAD project, like I said, where we are empowering youth to make sure that their voices are heard. So heard everywhere and represented daily. And thanks to NORSAC for as our donor, having made this HEAD project a living reality within the family and constituents of Inspired to Act. Yes. So basically, that is.
So you said you wanted to.
Yes, I wanted to add issues. A little example I thought of that I want to bring for all of us to appreciate the significance of testing. You may not test because you don't want to test, but you can test because you have to test. When you want to test, that is your decision. The sickness didn't invite you before it will enter you. It will not invite you before it will enter you. It will future not invite you before it will enter into your system. So it will not invite any member of your family before they are struck down. It's a passionate appeal I'm saying, because I have an example. I think that everybody who happens to tell yourself that I'm not going to go for the test, ask yourself one question. If somebody comes with a knife to stab your mom, will you allow them to stab your mom? This is a very passionate appeal. You will fight the person to death. You are likely to even take the stabbing of your mother. But unfortunately, TB is more killer, because at our mothers at 70, at 60, they are diabetic, they are hypertensive, they are what have you. You are strong. You are already exposed. And you are telling yourself that you are not going for treatment because of your ego or because of the stigmatization. Of course, like we have told you that stigma at TB is almost at a reduced end because of the interventions Inspired to Act is bringing to the communities. So this is an example that if you will not allow somebody to stab your mom, then please don't allow TB to stab your mom.
Give us your final words, Hajara.
Okay. Well, what I would like to say is I'm just encouraging family members, communities, and other people we should be each other's keeper. If you see that a colleague or a friend is portraying these symptoms that we just mentioned, you can equally encourage the person or go with the person to the health facility to check or to test in order for you to prevent yourself from also contacting the disease.
Okay.
And also, we as ITA, we are located at Jakara Yele, just few meters away from the Jakara Yele Dam. So if you want to locate us, you can come there.
It's very far from here, but those are wrong. I remember the first time I was coming to your office, I'm like, I'm going, I'm not reaching.
You are not reaching.
Yeah, it's far from here, but those around town is
it's a bit closer. Yeah.
Your final words?
Yes, my final words is, not everybody who is having TB is infectious. Understood? Not everybody with TB is infectious. Somebody can have TB and cannot transmit it. So we are telling the populace that, please, let stigmatization end. At ITA, we are an NGO working in enormous areas. All partners in terms of health-related issues are invited to work with ITA. And then my final word is to say a very big thank you to our Executive Director, Alhaji Rashid, for the opportunity of nurturing young men and women who are creating change in communities. Inspired to Act will be known for its goodness and contribution to communities. These are my last words, and thank you very much.
All right, thank you so much for coming. Today, dear, I have cornered IT. You know, that's one interesting thing about having partners who are passionate about the work that we all do and all that. I have been speaking with Baba Hajara and Abdallah Abdurrahman, all from Inspired to Act. You know, we've spoken about TB and all that, and we'll continue to partner to even have more health screenings. The discussions are in the pipeline. So anytime we hear that Matter Inspires Foundation is organizing a health screening, be there, because ITA will be there to provide services for. So
organizations could reach out to.
Yes, organizations could also reach out to ITA. You can even reach out to us, Matter Inspires Foundation. You can contact them on your behalf, and they'll come and screen your staff, especially like banks or schools. You know, you could just go into a school and to do that. Thank you so much for watching. It's been great bringing you this episode. Matter Inspired. Have a good night.